Okay. Doctor, before we start, I just want to confirm, and I know that I swore you in, but I've been asking every witness before we started if they have been sworn in. Can I confirm that you were sworn?
Yes, sir. I was sworn in.
Okay, thank you. And I'm going to let the parties know who are currently on the line. This witness is going to testify remotely through Google Meet. There are going to be some exhibits displayed to her through Google Meet. I do remind the parties you are not permitted to take screenshots of these exhibits or to copy them and to share them or to make any sort of copy of these exhibits as they're shown to the doctor. Ms. Gonzalez, you may proceed. Doctor, we're going to try and conduct this examination with the attorney standing at the podium. The microphone there goes to our recording system, but it does not amplify her voice here in the courtroom. If you are having trouble hearing her, we'll work around that and have her come up to the podium. So let us know if you're having trouble hearing her. She can come up to the bench, but we're going to start with her at the podium right now.
Thank you, Judge.
Can you please state your name for the record?
Heather Marshall Vaskas.
Okay. And where are you employed?
My full-time employment is with Holy Cross Medical Center in Taos, New Mexico, but I also do, I'm an independent contractor at Artesia General Hospital and work 2 to 4 shifts per month there.
So you said 2 to 4 shifts per month at the Artesia General Hospital?
In Artesia.
What
Correct.
department do you work those shifts?
Emergency department.
Now, Dr. Vaskas, were you working a shift in the emergency room on January 27th of 2023?
I'm sorry, I couldn't hear that.
Were you working a shift on January 27th of 2023?
That's correct. Yes, I was.
Okay. Do you recall the hours of that shift?
7 p.m. to 7 a.m.
On that date, did you have contact with Alexee Trevizo?
She was a patient, yes.
Okay. And what was Ms. Trevizo in the emergency room for?
Could you repeat that?
What was Ms. Trevizo in the emergency room for?
She presented with a complaint of back pain.
Was she admitted to the emergency room?
I didn't quite catch it. Was she what to the emergency room?
Admitted?
She was evaluated in the emergency department. Correct. She was a patient in the emergency department.
Can I approach it?
You may.
Can you hear me better from here, Dr. Vaskas?
Yes.
Okay.
Thank you so much. I'm so sorry.
No, that's okay. It's not your fault. So she was evaluated in the ER, and was she, I said admitted, or was she taken back and placed in a room in the emergency room?
She was, so if I may just clarify, the term admitting indicates a patient was admitted to a hospital.
Okay.
An emergency department is not considered, a patient checks into the emergency department, which she did.
Okay.
She was placed in a room in the emergency department for further evaluation.
Okay, I understand. Thank you for clarifying that for us.
Yes.
So you said her chief complaint was for pain. Was she treated for that pain?
Well, she was evaluated, and I felt that she needed additional evaluation other than just the physical examination. So laboratory studies were ordered initially, as I believe, I don't have the record in front of me, so I cannot tell you at what time a CT scan was ordered, but I believe it was at the time of the initial evaluation.
Okay. The tests were ordered. While you were either conducting these, waiting for results, or while she was just in your emergency room, did something happen with Ms. Trevizo that caused concern or an issue?
Well, she was complaining of very severe pain, and she would not allow me to physically to examine her completely. So she was walking around the evaluation room, and I couldn't complete a abdominal examination. I was able to look at her back, but I couldn't complete the evaluation. And that seemed it was a little bit inconsistent with what you would normally expect, like a muscle strain. And so I felt that further investigation was warranted to make sure she didn't have a kidney stone or additional things going on. And we always order a pregnancy test on a patient who presents, if it's a woman within childbearing age, they get a pregnancy test no matter what. And so I ordered a pregnancy test as part of the evaluation, knowing I thought I might have to do a CAT scan. And we generally don't do CAT scans on pregnant women because of the risk of radiation.
Okay.
So these tests were ordered, and then as I had finished evaluating her, she abruptly left the evaluation room to go to the bathroom.
So let's I just want to go back. So you said that you were having difficulty evaluating her, performing an examination on her. You said she was walking around the patient room?
That's correct.
Is that uncommon for someone who comes to the emergency room?
It was difficult to answer that. Each case is different.
Okay.
Some patients are so uncomfortable that you cannot evaluate them without administering medicine. So we will frequently administer medicine to try to make a patient more relaxed or more calm so we can so either we can get a better history or get a better examination. And that was my hope in this case.
Okay. So
initially.
You provided some medication in the hopes that you would be able to evaluate her situation.
And she was very obviously uncomfortable. And again, as I mentioned before, my initial concern was kidney stone or something of that nature, because she was then complaining of back pain.
Okay. So then you said that the defendant, or excuse me, Ms. Trevizo abruptly left the examination room. And
That's correct.
Where did she go?
She said she was going to the bathroom.
Okay. Did she say anything else about why she was exiting the exam room?
She did not, but at that time I asked the patient and her mother who had brought her if there was any chance she could be pregnant, and I cannot remember if the patient responded, but her mother said that categorically it was impossible, that she had been buying her pads every month, and she was certain she'd had periods every month. There was no way she could be pregnant.
Okay, and so with this information that you received, did you see any issue in Ms. Trevizo going to the bathroom?
No, I mean, the emergency department, patients have their free will. They can, I mean, if she wanted to go to the bathroom, that's within her rights.
Sure. Okay, so Ms. Trevizo goes to the bathroom, and does there become an issue with her in the bathroom? So after when she went to the bathroom, then I went back to my workstation and began entering orders as well as initiating my documentation. And I was not aware that she hadn't exited the bathroom until much a period later. It was after we received a positive pregnancy test, and we were waiting to get a further quantification of what we call basically it's a quantification of the pregnancy hormone level, because that was really critically important to me from a medical standpoint, because as soon as I realized that her pregnancy test was positive, another diagnostic possibility that's potentially life-threatening, specifically a ruptured ectopic pregnancy, becomes concerning. And so we really need that hormone level, like the actual numerical number, to evaluate how risky it is that a patient could potentially have a ruptured ectopic pregnancy, which is life-threatening. And so it was, I can't tell you the amount of time that it elapsed because I don't have access to the medical record right now. But at some point, as I was waiting for the final hormone level to become resulted, I asked where the patient was, and I was informed that she was still in the bathroom. And at that point, myself and the nurse went to the bathroom, and I said, we need to get her out of there now. Because I was concerned that there could be a life-threatening emergency, and we needed to get her. We needed to call in an ultrasound tech, because we don't have 24-hour ultrasound at the hospital. And so there were just things that needed to happen, and at that point, we couldn't get her to come out.
What do you mean by you couldn't get her to come out?
We knocked on the door and said, you need to come out. There was probably about a 15-minute period from when I said we need to get her out of the bathroom to when we got access to the bathroom. I heard the toilet flush several times, and so I kept thinking, okay, she's flushed the toilet, she's going to come out, and then she didn't. And when I heard the toilet flush the second time, I instructed staff to get keys to the bathroom and to forcibly get into the bathroom.
Okay. Did you have to forcibly get into the bathroom, or did Ms. Trevizo come out?
I'm sorry, I cannot recall. I don't know the answer to that.
Okay. Were you present at the bathroom when Ms. Trevizo came out?
I was.
Okay. And did you notice anything about her that was different from when you had seen her in the patient room?
There was a significant amount of blood in the bathroom. It was everywhere. It was on the floor and the toilet. And so, if you recall, I said we have to call in an ultrasound tech. Mm-hmm. We had an ultrasound machine in the department, but it didn't have the right kind of probe. But when I saw the amount of blood, I just was concerned that there was an emergency of some kind happening. And so I wanted to, even though I didn't have the right probe, I thought, let me just look and see if I can see if she has this ruptured ectopic pregnancy. And so I myself and a nurse walked her back to the room, and I got the ultrasound. And again, I didn't have the right piece of equipment. I had to call in the tech for that. But I couldn't really see much with the ultrasound, but she was bleeding a fair bit. And so at that point, we proceeded to perform a pelvic examination so I could figure out either how much she was bleeding, or if she was having a miscarriage was another possibility. And so, yeah, I'm sorry, I'll stop there.
Okay. So you weren't sure what was causing all this bleeding, but further studies needed to be done. Correct?
That's correct.
Okay. So, do you know, let me withdraw that. So while you were evaluating and or treating Ms. Trevizo, did you get pulled from her to another issue?
Did I what?
Did you get pulled from tending to her to tend to another issue?
I do not recall. Well, let me rephrase. I performed the ultrasound. I left the room to get the room set up for a pelvic exam. The nurses had to get some equipment. We went back in, and I performed the pelvic examination, and there was so much bleeding. It took me a very long time. The cervix was completely open, and so at that point I began thinking, well, she must be having a miscarriage. And there was a lot of bleeding, and so sometimes in order to help stabilize a patient if they're having an active miscarriage, we have to evacuate all of the blood and other products from the uterus or from the cervix. And so it took me about 15 minutes, and there was just really significant amounts of clot. And so just as I had finished the examination, the charge nurse did come into the room and said, "Dr. Vaskas, I need you outside immediately."
Okay.
And so the nurse stayed in the room in order to help get the patient cleaned up. And then I walked out into the hallway, and charge nurse HT informed me that a dead baby had been found in the trash can of the bathroom.
Okay. So when you got this information from HT, what did you do from there?
Well, my first obligation, or my first choice was I wanted to see if the baby was alive and needed resuscitation. And so I said, where is this baby? And they brought the trash can to me. And I grabbed it and I just ran with it into a resuscitation room, and I turned it over onto the bed, and the baby came out and was on the gurney.
Okay. Can you describe how the baby was situated in the trash can when you saw it?
I never looked in the trash can. My priority was in assessing for resuscitation.
Okay.
And so I didn't look in. I just turned it over and put it on the resuscitation gurney so that I could assess whether or not the baby was alive, if there were signs of life, if the baby needed resuscitation.
Okay. All right. And so when you did turn the trash can over onto the bed, you said the baby came out. What was with him when he came out?
I don't recall. All I can tell you is that the baby was cold and pulseless and dead.
Cold, pulseless, and dead. Did you make any attempts to resuscitate him?
I did not. I assessed for breathing, which there was none, pulse, which there was none, and the baby was cold, which suggested to me that he had been in the trash can without air for a longer period than what would make for the remotest chance of a successful resuscitation.
So based on your assessment, you determined that he was deceased.
That is correct.
Dr. Vaskas, I'm going to show you what I'm marking as States Exhibits 5 through 18 for purposes of identification. I don't know if I may publish those
You may.
in the Google Meet. I'll show it to you first. Oh, no, it's okay. Can you see those, Dr. Vasquez?
The bottom half is cut off.
And I'm going to have to scroll down because some of them are scanned long ways instead of widthwise. So I'll go through slowly, one at a time. If I'm going too fast, please just let me know, okay? So this is States Exhibit 5.
Okay, I can see it.
This is State's Exhibit 6. This is State's Exhibit 7. This one is number 8. It's number 9. This is number 10. This is number 11.
Just tell us that your client seems to have a question.
Circulation change.
This is number 11. This one's number 12. It's 13. This one's 14. $15. $16. $17. And then this one's 18. We're able to see all those photographs, Dr. Vaskas?
Yes, ma'am.
Do you recognize what's depicted in these photographs?
Yes.
Do they accurately reflect the baby that you treated on January 27th of 2013?
Yes.
Okay. Your Honor, I'd like to move State's Exhibits 5 through 18 into evidence.
Mitchell.
I've noted everything, Your Honor.
State's
Thank you.
Exhibits 5 through 18 are admitted to evidence.
They're exactly the same. They're just part of the same. No, I'm going to put a photo up for us to discuss, Dr. Vasquez. And it's going to be State's Exhibit. This one. State's Exhibit 6. Can you see that one?
Yes.
So, is this, you previously testified that you had just dumped out what was inside of the trash can. Was this how you assessed the baby when you made, checked his vitals, determined he was cold, etc.?
Yes, we made no, very little alteration to the position of the baby on the bed.
So the bag that we see on the left side, is that the bag that this baby was contained in?
All I can tell you is what we see right there. I don't know.
Okay.
I didn't, it came out of the trash can with the baby.
Okay. So that was in with the baby?
That's correct. And I don't know what manipulation happened prior to with bags or whatnot before I grabbed the trash can. I just don't know.
Okay, so all you know is what it looked like when you grabbed it?
That's correct. I took the can and physically turned it over to assess the contents, and then we didn't touch anything.
Okay. All right. Dr. Vaskas, were you able to tell how this baby had died?
No.
So once you made the determination that he was deceased, what did you do next?
Well, there were two nursing nurses with me at the time of the assessment. I instructed them to call the police and that we would notify the patient of what had happened with police present. Once I made that determination, I then proceeded to understand that the bleeding from the patient's cervix was from a delivery.
Okay.
And I did not know where the placenta was or if she had retained products of conception. And so my attention turned to stabilizing the patient and making sure she didn't die from a postpartum complication. And so at that point, I contacted the obstetric unit at Lovelace in Roswell, spoke with the on-call physician, whose name I cannot recall. I explained the situation and said we need to emergently transfer this patient so that she can be stabilized because we don't have obstetrics or gynecology at Artesia General.
So she was transferred to another hospital?
Yes.
Okay.
Yes, so my first step was stabilization of the patient.
Doctor,
Once that was finalized,
Please,
Dr.
please
Yes.
hold on for the question.
if you'll hang on, okay.
I'm sorry.
So you're making all these determinations for Ms. Trevizo to be transported to another facility for treatment, correct?
Correct.
Okay. And so you said you didn't want to speak with her or about this baby until law enforcement had arrived, right?
Correct.
Did law enforcement arrive?
Yes.
Okay. And were you able to inform or speak with Ms. Trevizo about this baby?
Yes. I went into the room with a nurse, and then I believe there were two officers, and I informed her that we had found a dead baby in the bathroom.
Okay. And did did Ms. Trevizo make any statements about this baby?
Yes.
What did she say?
It just came out of me and wasn't moving, so I put it in the trash can.
Okay. It just came out of me, it wasn't moving, and I put it in the trash can. Was there anything else that she said about the baby or the situation?
I can't recall.
Okay.
I think I felt that it was not my job to, I wanted her to understand the plan of care, which was she needed to be transferred
Okay.
to make sure she didn't have a postpartum complication, and therefore, I do need her consent for that.
Okay. So you
And so I wanted,
discussing the transfer and giving her that information when these statements were made to you.
That's correct. And then the officers were present, and I wasn't present for the further communications. The patient's mother was present, and she began yelling, "I knew it, I knew it."
Objection to the hearsay.
Sustained.
Without telling us what anyone else said, Dr. Vaskas. So
Apologies.
after this contact with Ms. Trevizo, you said you weren't present for anything with the officers. So once you got her transfer situated, was that the last contact you had with Ms. Trevizo that day?
I believe so.
All right. I don't have any further questions. I'll pass the witness.
Mr. Mitchell.
Thank you, Your Honor. Where's the best place here, Judge?
I think this area, just in
All right.
general. This is the mic here, so she'll be able to hear you from there.
Doctor, help me learn to pronounce your last name properly.
Vaskas?
Vaskas. All right, Doctor, you were on a contract with Artesia General Hospital. Is that emergency to do ER work for them? Is that correct?
Yes, sir.
And as I understand it, this patient, and I'll refer to her as Alexee, came in to Artesia General Hospital into the emergency room at approximately 5 minutes after midnight. Is that correct?
I don't have access to the record, so I'll have to trust you on the timing.
Sure. And there was an initial assessment of complaints of low back pain, had cheerleading practice, has abdominal pain, and the notes indicate exam of abdomen, soft, non-extended, mild tenderness along both lateral aspects of abdomen. Were those your notes?
Yes, sir.
So you did examine her abdomen.
Yes, sir.
And would that have been done almost immediately after she came into the emergency room?
At the time of the initial evaluation, yes.
All right. And there's a lot more to that, but I'm just getting to specific issues of the day. And then at 18 minutes after midnight, I believe medication given via IV of acetaminophen and, help me with the pronunciation, cyclobenzaprine. Does that make
Correct.
sense?
Yes.
All right. And then at 28 minutes after midnight, medication was given of sodium chloride, Zofran, morphine, and ketorolac. Does that make sense?
Yes.
All right. So, and you're the only one in the emergency room, since you were the on-call doctor, that could have ordered that medication be given. Am I correct about that?
That's correct.
All right. And from the records that we've looked at, their lab tests were ordered at 28 minutes after midnight to 30 minutes after midnight. In other words, I'm not sure how your computer system works to order those, but I assume you ordered them and they were taken or collected by 30 minutes after midnight. Does that make sense? Within 2 minutes after you order them, they're collected.
I'm not sure I understand the question.
Well, I'm just asking if that was the next thing that happened in the care of this patient.
I think so, yeah.
And I want to be very fair with you, so I'm going to read this note, this hospital note, to you, and I'll use the words that are on the note. Preg, serum SERUM, ordered at 0028. collected at 0030, received at 0031, and reported at 0051, RN with positive A. I mean, with positive A, not RN. Does that mean that the blood tests were sent, were ordered, collected, received, and by 51 minutes after midnight, the lab had reported that she was pregnant?
Yeah, they would have reported it into the computer system.
Right. And we discussed with Chris Sanchez, one of the RNs that was on duty that night, the triage nurse. I assume at Artesia you have computerized systems that at the nurse's station or in your office you would have received that report. Am I correct about that?
Yeah, you have to, either the lab would call, and I just don't recall in this case if they gave us a verbal notification or not, and then you would have to go into the system to retrieve the result.
Right. And once that occurred, prior to her going to the bathroom and coming out of the bathroom, did you ever tell the patient, your patient, that she was pregnant?
I'm sorry, sir. Could you ask that one more time?
I certainly shall. Thank you. Doctor, after the lab report comes through at 51 minutes after midnight, indicating that she's pregnant, and prior to the time that she went to the restroom, did you tell the patient that she was pregnant?
No.
All right. And then, according to the videotape that's been introduced in this courtroom, and according to the notes, at 1:39, or military time 1039, Alexee enters the bathroom in the hallway of the ER at Artesia General Hospital. All right? Does that make sense?
I just don't know if I know she went to the bathroom when I first saw her. Are you trying to say that she came out and went back in?
No, I'm not. I'm just saying that at one point in time she went to the bathroom where the allegation is that she, when she went to the bathroom, she delivered a baby. She had a baby. And I assume that's what we're all talking about here. Is that right?
I'm sorry, what's the question?
Well, the question was, here's the point. If you look at the videotape in this case of the hallway in the emergency room, at 1:39 is when she goes to the bathroom. Did you actually see her go to the bathroom? Go down the hall to go into the door to the bathroom?
No, I did not.
Now, prior to her going into that room,
On the second event, at 1:39, no, I did not see that.
well, let me help you out here, doctor, because I know that you or somebody ordered a UA, and she went to the bathroom to try to do that UA. That was long before this, and that you did not get a UA and you did a blood test. That's what the records are indicating. Correct? Does that make sense now?
I don't really understand what you're at. What are you asking me?
I'm asking you if you or somebody else, let's do it this way. I'm asking you if you or somebody else ordered a urinalysis test, ask her to go to the bathroom and fill a cup.
I ordered a urinalysis test, yes.
All right. Did you see her attempt to fulfill that request?
Well, I didn't go to the bathroom with her.
No, that's not what I'm asking. Did she come back with any urine in the cup?
I think I don't recall. No, I mean I can't tell you with certainty because I just can't remember.
Okay. And then now I'm talking about this, the second time that she would have gone to the bathroom, which was at 1:39 in the morning, a.m. And this is the time that everybody in the courtroom's been talking about and hearing about. Did you actually see her at that time go to the bathroom?
No.
Prior, and I've asked you already, I'm not going to ask it again, but and you indicated that at some point in time, ER staff checks on her. Is that right?
Well, I asked where she was, and I was told she was in the bathroom.
All right. And, doctor, are you telling us that when she came out of the bathroom, you escorted her to her room?
Yes, I am telling you that.
And did you, after she was in the treatment room, or whatever you call it there, after she's been in the bathroom, did a nurse help her remove her clothing and get into a hospital gown?
I don't recall.
Okay. When you conducted later on an examination, was she in a hospital gown?
Yes.
And if the medical records indicate that at 2:02 is when you, is the first mention of a transvaginal ultrasound ordered after post-pregnancy, does that make sense to you?
Does what make sense to me?
That you ordered a transvaginal ultrasound,
Yes.
but you guys didn't have the equipment to do one. Is that fair?
That's correct.
So you're limited as to what you could do with the doctor by the equipment that you had available.
That's correct.
And it's only after that, when you're working with your patient, Alexee, that then you get notice that they found a deceased baby in the bathroom.
That's correct.
All right, I think I've got it down. And you gave the time of death of the infant as 2:38.
Okay.
Well, I'm
I don't have access to the records. I can't recall the time, but if that's what I documented, then that's what I did.
okay. Doctor, was she your patient?
Yes.
Did any other doctor treat her at Artesia General Hospital?
Not on that occasion.
Okay. Was there a point in time when you were concerned after the initial study and you got the initial vitals, or whoever got them for you, you looked at them, with the patient's heart rate?
Yes.
Okay. Once you learned and the nurse learned that she was actually tested positive for being pregnant, am I correct that Artesia General doesn't have an OB ward or an OB floor?
That's correct.
And anybody, you have to refer all the patients that are, well, sometimes they have a baby anyway, but you normally refer them to another hospital? Is that what happens?
Well, depends on the situation, sir.
Yes.
So, if a patient is going to deliver a baby, then
Doctor, there's an objection, standing objection.
Your Honor, I'm
Yes.
going to object this time for irrelevance. I've kind of bit my tongue a little bit, but we're getting into things that don't have any relevance to the issue at hand here, whether or not
Judge, I'll
there's
move it
an
on.
OBGYN,
Okay, for the record, it's sustained. You may
Yeah,
continue,
I'll
sir.
move it on. In fact, I have nothing further of the doctor. Thank you.
Anything further?
No, Your Honor, she may be released.
Before I release you, I do have just two questions for clarification, Doctor. Number one, You said you didn't see the defendant, Ms. Trevizo, going to the bathroom. Were you inspecting, or were you conducting an examination when at 1:39 she went to the bathroom? Were you in the process of conducting an examination when she told you? Because there was a little bit of confusion there for the court, whether you were in the middle of the examination when she went to the bathroom.
So, and I apologize for any confusion, but the best I can tell you is that when I was initially evaluating her, she left during the evaluation to go to the bathroom. I then did not see her. My desk where we sit and work is not in a place where it would be easy to know if the patient was coming and going from the bathroom. So I have to rely upon what's documented in the record as to the fact that she then went back to the bathroom at 1:39. I did not see the second time. And I never saw her physically enter. I saw her get up and say, I've got to go to the bathroom.
And then my second question is, you mentioned that there was some discussion about her telling you that she was not pregnant and that she was having her regular period. When she said that to you, is my understanding that you did not inform her at that point that she was pregnant?
Well, I didn't have the result at that time.
Okay.
I told her after, when I was at the time we got her back in the room and said, your test is positive, we need more tests to stabilize you.
So there was a statement to her that her test was positive, or was there no statements to her made before this alleged incident that occurred in the bathroom? When she went to the bathroom, was there any statements made to her of that nature?
By myself, no. I was waiting for the number level, because if that number was high or if that number was low, really changed the direction that we would go in terms of diagnostic path. And so I don't know if someone else told her, but I did not tell her of the positive test until after we got her out of the bathroom.
And I thank you, doctor. I just needed a little bit of clarification on that. If there's any questions from either party regarding my questions, you may ask. If not, the doctor may be released from subpoena.
No, you cleared it up. Thank you.
Okay, doctor, you've been released from subpoena. What that basically means is you're not going to be called back as a witness. You are free to go. You are not going to be required to be on call to come back and testify.